Hello and welcome to Pharmacy Skills. We're looking at the cardiovascular system here, and in this chapter we're looking at arrhythmias. Arrhythmias, not all arrhythmias are created equal. They come in different shapes and sizes, and that's why it's important to diagnose the precise arrhythmia before attempting treatment. This video will explore various arrhythmias and you will be able to identify their defining characteristics. Arrhythmia is just an umbrella term to describe abnormal heartbeats. First type of arrhythmia we'll look at here is ectopic beats. They are just palpitations that can happen occasionally. You may have experienced them yourselves. They rarely require treatment, but if someone finds them particularly troublesome, then beta blockers can be given because beta blockers are generally safer than other suppressant drugs, which we'll explore later. The next arrhythmia is atrial fibrillation, which is characterized by an abnormally fast heartbeat. But not only is the heartbeat fast, it's also out of rhythm. The treatment aims for AFib once it is diagnosed is to reduce the symptoms of AFib and prevent complications, especially stroke. Stroke becomes increasingly likely once a person has AFib. The two ways you need to know of treating AFib are through rate control or rhythm control. Rate control just involves reducing the heart rate, and rhythm control involves synchronizing the heart rhythms by making it start from the same spot, the sinus, known as restoring sinus rhythm. Now, what do you do when a patient has an attack out of nowhere or an emergency situation? These kind of situations are known as acute presentations. You want to correct this as soon as possible, and the fastest way to achieve this is with electrical cardioversion. Electrical cardioversion is a procedure in which an electrical current is used to reset the heart's rhythm back to its regular rhythm, again known as sinus rhythm. Drugs take a bit longer, which is why they're not the first point of call in a life-threatening situation. However, if the patient comes in with an acute presentation but it's not an emergency situation, then we can use drug therapy, either to control the rate or to control the rhythm. If it's been 48 hours or less, okay? If it's been 48 hours or less, then rate control is preferred. But if it's been more than 48 hours, then rhythm control is preferred. For emergency rate control, we would use a beta blocker or verapamil intravenously. And for rhythm control in an emergency situation, we'd use intravenous amiodarone or flecainide. One thing to consider with electrical cardioversion is that the procedure carries an increased risk of thromboembolism. It is therefore important to thin the blood to prevent this from happening. If possible, using oral anticoagulants for up to 3 weeks. But if you can't wait 3 weeks, then you could use intravenous anticoagulants. Another type of arrhythmia is paroxysmal atrial fibrillation. Paroxysmal atrial fibrillation occurs when a rapid erratic heart rate begins suddenly and then stops on its own within 7 days. It is known as an intermittent atrial fibrillation and often lasts less than 24 hours. Treatment usually involves a standard beta blocker. If symptoms persist or if the beta blocker is not appropriate, then other drugs such as amiodarone, flecainide, propafenone, or dronedarone can be given. Some patients who have this arrhythmia occasionally on and off can be treated using the pill and pocket approach. The BNF talks about the pill and pocket approach, which just involves taking a pill when needed to treat their symptoms, as and when. The next arrhythmia we need to consider is paroxysmal supraventricular tachycardia. You can put together the words using the title to understand this arrhythmia. An arrhythmia that occurs intermittently, off and on, and it occurs supraventricular, which is above the ventricles, so affects the atria, and it's a tachycardia, an abnormally fast heart rate. Ventricular arrhythmias tend to be the most serious, life-threatening kind that can result in cardiac arrest, but paroxysmal supraventricular tachycardia doesn't occur in the ventricles, it occurs in the atria. This type of arrhythmia will often terminate by themselves spontaneously or with reflex vagal stimulation, which is done using various methods including immersing the face in cold water or carotid sinus massage. Such maneuvers should be done while monitoring the ECG. If the methods don't work and the symptoms are severe, then drug treatment can be considered. And if that doesn't work, you can consider electrical cardioversion. If the patient has episodes that go away but then later on come back after an extended period of time, then you can consider catheter ablation. Catheter ablation uses heat, which is radiofrequency ablation, or freezing, which is cryoablation. These two procedures are performed on the area of the heart that is causing the abnormal heart rhythm. This treatment creates scar tissue, which breaks the abnormal circuits of the heart or muscle that is triggering the abnormal heartbeat. The next type of arrhythmia is torsade de pointe. If you have looked at the CNS chapter, you may be familiar with this condition, as there are many drugs that increase QT interval. Torsade is a type of ventricular arrhythmia. On the ECG, it shows a widened QT interval. It can also be induced by hypokalemia and a very slow heartbeat. The last kind of arrhythmia we need to consider is ventricular tachycardia. The last arrhythmia we must be aware of is ventricular tachycardia. It can come in the form of a serious pulseless ventricular tachycardia. Pulseless ventricular tachycardia rhythm is primarily identified by a few criteria. First, the rate is usually higher than 180 beats per minute, and the rhythm generally has a very wide QRS complex. If the patient has ventricular tachycardia, remember, ventricular arrhythmias can starve the vital organs from oxygen and cause heart attacks. Therefore, they must be treated promptly. If the patient has ventricular arrhythmia or pulseless arrhythmia, then you need to give defibrillation. Now, defib and cardioversion both use electricity, but there is a key difference. Cardioversion is delivering electrical current that is synchronized, whereas defibrillation is non-synchronized delivering of electricity randomly to the cardiac cycle. If the patient has ventricular tachycardia but is otherwise hemodynamically stable, and I want to explain what the word hemodynamically stable means. It means they don't have their cardiovascular vital signs out of range. So these cardiovascular vital signs include things such as low blood pressure. If a patient is hemodynamically stable, then they can be given drug treatment. Such patients are generally referred to a specialist and may still be at risk of cardiac arrest even after treatment.